Welcome back, and you're watching Healthwise, your community health information program. We've been speaking with Dr. Scott Rohner, Rohner Chiropractic here in Opelousas, and really interesting. We've been sort of talking about the pain related to the muscles.
Right, right. And I
brought out some great points.
Well, I kind of chose as a topic that I wanted to talk about, just so people can understand that we do treat the spine, we do treat the joints of the spine. We also treat, I think people are mostly familiar with that. They also know that we treat the nerve problems. So we also, I wanted to show that we do treat muscular problems as well. And they're integrated very closely with the spine as well. So if it's muscular or neurologic, muscular or skeletal. So it'd be neuromusculoskeletal is the type of problems that we're really geared towards treating.
Okay, well, excellent. And I think we're going to take a look at some.
We got a ton of them to go through.
A ton of them.
So this is
really interesting, though.
This is another muscle. This was the major muscle that pulls our body to the side. It's the prime side bender. And if you lift something in your left arm, so like as we're looking at this picture, you bend something with your left arm, that picture on the left side where those two X's are, that's the muscle that would hold you from falling over. So we always carry stuff with one arm, and that muscle it's going to get a strain on it. And that's those red areas are the distribution of where we're going to see the pain with it. So that the top one's going to go more around the crest of the hip, and then the other one's going to drop down lower around the hip bone. A lot of people say they have bursitis. Very much, you can come back to us again. They do have bursitis. People get bursitis that in their hip. It doesn't necessarily mean it's coming from that. That's just something that we need to look at in the differential. Maybe it's coming from bursitis directly where the pain is. Maybe it's coming from a remote area, and that's why we look at referred pain also. So this is not the core of where pain comes from, the core of pain management. It's just a very common thing that's missed a lot, and why a lot of people may get failures with their treatment.
And hearing you say all these things, you know, you've got to really look at so many factors because in try to pinpoint. It's
a diagnosis is probably going to be the most it's the most crucial of your management of your case is the diagnosis. It's the most complicated portion of your case, but the treatment is where you really are going to get your benefit. But
Absolutely.
You've got to get the proper diagnosis if you want to get the proper treatment so you can get the outcomes that you want to get.
Absolutely.
And I think we got some more coming up here. That's another one of that muscle that produces the pain into the buttocks. And we'll go again to the next one. And then here's somebody that has some pain in their knee. We see that there's trigger points along the sides of the leg that can cause that. We'll go to the next one again. And now we're going back to seeing what that spine's supposed to look like when it's in its normal position. So the next the next picture shows us the muscles have equal tone on both sides. So the muscles up in the sides of the spine, the muscles in the hips, the muscles in the inner thigh all have equal tone, and that's what holds you in that symmetrical posture. So when we look at the next picture again here, now there he is, he's out of alignment. And we know that there's something else going on with it. It's not just the bony misalignment, it's also the underlying muscles. And as chiropractors, we're trained to look at alignment and really be able to see what the underlying muscle condition is. Now on this guy in particular, you see also around his shoulders, he's got his shoulders are rolled forward, and you can see you see his palms from behind. So if we see the next picture, we see that all the muscular component, and there's also some muscles up in his upper back. So the next one's going to show us here some problems. So these muscles, that kind of a coat hanger looking muscle, it's called the trapezius. It has a load of trigger points in it, potential trigger points in it that can produce problems from pain in your shoulder blade, pain out on the sides of the shoulders, headaches. And the next one again. Here's a muscle in the front of the spine, on the front of the neck. This is really an overlooked muscle as a source of pain. I see people that have that shoulder blade, like you see in the picture on the left. 90% of them, this whole source of their pain is coming from the front of their neck. This is you can come back to me again. I'm going to use myself as a visual. When we sit and we start to slouch, our heads drop forward. We hold our head up when we're sitting at a computer or whatnot. The whole front carriage of the neck is very tense. We carry all this stress up here. But all the pain that we're going to get from it is generated behind us. So until we treat these muscles in the front as well, or at least look at them as a source of pain, we're not going to get rid of that shoulder blade pain. So let's go back to that again. To the one behind it. This person also, you can see they have, on the right side, they have pain in their chest. I've had several people that spent the night in the emergency room, thought they had a heart attack because of this tension in their chest and the pain radiating into their back, and they came and they were waiting for me the next morning. The emergency room told them, they said, I don't know what it is, maybe you should see your chiropractor. And they come in and we get them feeling better within a couple of hours. Now, you can come back again. I absolutely do not want to lead anybody to think that you should not seek emergency help. If you're having chest pain, be smart. Err on the safe side. Go to the emergency room. You could have that pain behind your shoulder blade. It could also be coming from a gallbladder problem. Is
that so? Wow.
Organs will refer back to things as that as well. So don't bypass your medical diagnosis either. I mean, we work hand in hand with medical doctors and to pick the proper course of treatment, because we go through and we do the proper diagnostics and make sure that we're not missing something.
And Dr. Rohner, speaking of the medical side of things, the diagnosis, as you mentioned, do patients need referrals from their medical doctors to visit you? You
can get a referral from your medical doctor. If you want to come and see me, you can get a referral, but it's not required. I do take walk-ins. There's a walk-in welcome sign right out front. You don't have to we do insurance. You don't have to get a referral from your attorney. If you get in an auto accident, you can come directly to me. If you need an attorney, you can always follow up and get an attorney later. And there's quite a few that I've worked with that have been real comfortable with. So
good. Well, I'm sure a lot of people wanted to have those questions answered. And thanks so much. Very informative. Dr. Scott Rohner, Rohner Chiropractic, and your office, Highway 182.
That's right, 5885 Highway 182.
Here in Opelousas. All right. Well, we'll see you next time on Healthwise.
Healthwise is brought to you in part by Opelousas General Health System.